And joining us to talk more about it, Nick Tate, our Newsmax Deputy Health Editor and author of the Obamacare Survival Guide. Nick, welcome back to the Anchor Desk. And in addition to those who have no history of heart disease, is there a specific demographic aided most by this test?
Women, yes. The study is particularly sensitive in women and black women in particular. Now, historically, men have been the focus of heart disease and heart attack, but of course we know that heart disease is the leading killer of women as well. In fact, somewhere between 3 and 5 times as many women die from heart disease as from breast cancer.
It's like 1 in 4, right?
Right, that's right. It's a big number. So this test looks at inflammation in the blood vessels, which is tied directly to a future heart attack risk. And even with people with no symptoms at all, it can indicate whether you are at risk.
Now, you mentioned earlier that a lot of the tests that were done prior to this were predominantly done on men, right? Up until fairly recently. So this is really big news for people out there.
For women's health as well as men's health. Yeah, historically, all clinical tests have involved men, and the presumption is that women have the same experience. But we know with heart disease that women have very different experiences and very different symptoms than men do. They tend not to have the crushing heart chest pain that men have when they have a heart attack, for instance, and their symptoms are subtler. So that's why a test like this can be very helpful in helping in getting doctors the ability to say, you are at risk, you need to be doing something with your lifestyle to reduce your risk of a heart attack.
So when will doctors start offering this test?
I would, since the FDA has approved it, insurance companies will cover it. My guess is it'll become a standard part of testing probably in the early part of next year.
And again, the way it works is to basically use the blood test as a measure of inflammation?
That's right. They do a blood test, and they're looking for a particular thing. I'm going to look at. It's LAPLA2. They'll probably come up with some snazzier name for it.
I got it right now. It's LAPLA2.
There you go.
But it checks for inflammation levels in the blood vessels, which are they indicate that in fact there's a blockage in an artery, and that leads to heart attack.
And this is like basically the buildup of plaque,
right? That's right, hardening of the arteries. So it's a biomarker that you wouldn't normally see.
Why does this better serve women?
Well, they're not really sure about that. They think it is more sensitive in women, and as we know, men and women are different biologically, so there are some factors.
Yes, thank you for noticing. We all
They're not quite sure why, and they're not quite sure why black women in particular it's very sensitive in, but I suspect we'll get some answers to that, but the truth is that it is a more sensitive test for women and black women, and that's good news for them. And
will this be covered by insurance, we hope?
Likely. You know, when the FDA approves something like this, it does typically become a standard of testing. The first thing we'll look to see is whether Medicare will cover it, and they probably will, and once they do, the insurers will follow suit.
And we're pleased to break ground on this program this morning, giving you the shorthand LAPLA2 for the name of the
I just like hearing you say it.
LAPLA2.
LAPLA2.
But see, they're going to have shorthand so that, well, it sounds so lyrical, but the real thing is, for a guy from a family with a history of heart disease, this inflammation thing. Now, this test is not a lead pipe sense that you're going to have a heart attack, but...
That's right. And in fact, you know, that's the key thing. A test like this, the primary benefit of a test like this is it will tell you what you need to do in your lifestyle to reduce your risk of having that heart attack or having heart disease. You know, millions of Americans take statin drugs on the hope that they will prevent heart disease and a heart attack. And I think the problem there is the sense that many Americans have that, well, I'll take this pill and then I'll eat whatever I want, I won't exercise every day, I won't worry about managing my weight or my stress levels.
Listen, I missed my running yesterday, but I needed a little bit of a nap.
But a test like this can tell you, if a doctor comes to you and says, you know what, your blood test tells us that you are at risk, you can't just take a pill, you need to get daily exercise, you need to eat a Mediterranean-style diet, you need to get enough sleep every night and manage your stress levels. It might be the factor that will put you over that hump to do all the work that you need to do.
And what are some of the key factors that make you more at risk of having a heart attack?
The big one is obesity. 2 out of 3
so
Americans are either overweight or obese. Unhealthy diets, high levels of cholesterol are concerns. So you manage those things, you manage stress, you get enough sleep, you do all the things you should do for your health.
But you need to have good fat as well in your diet too, because
That's
people I know can have heart attacks if they don't have enough good fat in their body. See, they're happy to hear
good
that.
fat, olive oil, nuts, fish, those kinds of fat, healthy fats are really good for you.
When I hear you say Mediterranean diet, I kind of think Italy. I think red wine It's probably some of the other stuff I ate along with it that could be.
Red wine in moderation is
In
okay.
moderation
May, in
is
fact,
okay,
be good.
right?
But we're talking about things like you don't eat a lot of high carb foods. You don't eat a lot of sugary foods. You eat a lot of lean protein. You eat a lot of nuts, olive oil, healthy fats is what we're talking
And what
about.
people don't realize is when they just think about carbs, they think about weight, but there's actually a lot of sugar that's hidden in those carbs to help preserve it.
A lot of those low-fat foods that you buy, the way they get to that low-fat level by cutting the fat is they pump up the sugar and they pump up the carbs. So you're better off eating a diet with healthy fats. It doesn't mean go out and garbage up on donuts and French fries, but healthier fats, as we're saying, nuts, fish, olive oil. You're going to be
Omega-3s, all that good
exactly.
stuff.
So we've got about a minute and a half remaining, and the holidays are upon us. We have now this gift of FDA approval for the blood test, but in terms of the gift of holiday parties and food and stuff, any hints for us? Where do we hang out for the healthy Christmas cuisine?
Well, the best thing you can do is you can fill your plate first with the healthy items, with the vegetables, have
Right.
the turkey, and that'll fill you up with the good stuff, and so you leave less room for the mashed potatoes and the gravy and the pumpkin pie and the sweets after. So like any other time of year, you want to be consuming in moderation. But you know what? If you have a little fun on Christmas Day or the holidays, as long as you stick to your diet and
Right.
exercise in the new year and get back to your regular pattern, unless you have diabetes or a significant health risk where you have to be careful about what you're eating at all times, one day a year is not going to kill you.
You know, for years we've been hearing about how much of a role high blood pressure plays when it comes to heart disease. There's been some controversy over that. So can you talk a little bit about sodium?
Yes, the latest study out this week says that salt is not the big problem with high blood pressure. In fact, it is sugar.
Sugar.
Sugar raises your levels of blood pressure higher than salt. Most Americans consume salt at a level that it's not going to be a problem.
This is marvelous.
Yeah.
I'm
He's
gonna
so
be able
happy.
to put salt on my
everything.
squash and broccoli and everything.
There is some
Thanks.
good news here.
There is good news. Merry Christmas to you,
Same
Nick.
to you.
And speaking of the heart, take Dr. Chauncey Crandall's Simple Heart Test now by going to www.simplehearttest.com. And also be sure to take the National Medicare Survey. Tell Congress what you think of the recent changes to Medicare. Again, Nick, we thank you for your time. America's Forum continues following this update.